What's going on, everyone? Happy Thursday. Hopefully everyone is doing well, staying safe, healthy, having a great day so far, and I really hope you are testing negative for all those viruses if you had to take a test. It is time now for the Thursday edition of the Virus Update for Thursday, September 25th, 2025. If you're new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. Let's face it, there's a lot of viruses out there, but not much media coverage. That's where I come into play, giving you the latest news, data, and really anything I can find to help keep you safe and informed. Want to stay informed? Subscribe to my channel down below. Give this video a thumbs up if you like it. Hit that notification bell. Share this video with anyone you know. And leave your comments down below. Alrighty, we do have several things to look at today, including news, some data. We do have some new data from CJS, and within that, I do have some notes that I added of my own from Out in the Wild. Yes, this is not an Out in the Wild update, but we do have some notes from Out in the Wild that are very important, especially to my state of Pennsylvania and Southeast Pennsylvania. And, of course, we also do have the UK, Ohio, and a few other things. Starting off with this, hand, foot, and mouth disease outbreak on the rise in West Virginia. Report shows, I think that should say outbreaks. Some of these local news stations, sometimes there's an error in their grammar. Take a look at this. The West Virginia Bureau of Public Health is alerting people to an outbreak of hand, foot, and mouth disease statewide. A total of 38 outbreaks have been reported so far this year, including 17 outbreaks since September 1st, according to the Bureau. Yeah, we've been seeing these popping up in many different places. I think there's probably schools involved with this outbreak. We've been seeing some school outbreaks, and yeah, hand, foot, and mouth disease. It's increasing. To be honest with you, prior to COVID, I don't recall hearing about so many outbreaks. Mind you, I didn't really pay attention until COVID hit me, and then COVID hit me hard, and then I was like, yeah, more people need to be made aware of what's going on. And, well, one thing leads to another. Now I'm reporting about other viruses as well here on this channel. All right, moving on to Montgomery, Alabama, where a charter school closes temporarily due to an illness outbreak, and they say all the usual things. A Montgomery charter school is closed for the rest of the week due to an outbreak of illness. Life Academy says the outbreak involves hand, foot, and mouth disease. The school will undergo deep cleaning and sanitization, and of course, it will reopen on Monday, September 29th. Students in this case will learn remote until then. I'll make sure this one makes it into the tracking thread on my website, datareport.info. I'll show you that in a little bit. Thank you to the person who alerted me of that outbreak. I reminded myself today, hey, I need to include that. I was alerted of that the other day. If you find anything that you think needs to be in the virus update, send it my way. You can send a DM, you can send an email, you can direct message me over on X, Blue Sky. We do have the Data Report Facebook page. That's a good way of alerting me. Send it to me. I'll look into it, and if it should fit into the video, we will add it in there. All right, Finger Lakes resident, this is in New York now, Finger Lakes resident confirmed to have West Nile virus. State data shows continued risk. We've been talking a lot about West Nile virus lately, at least a few times a week now. And this is a problem in Ontario County, New York. This is a portion of Western New York, I believe, anyhow, or close to Western New York. Yes, West Nile virus case has been confirmed. There have been 34 confirmed cases of West Nile virus in New York State this year, according to the CDC. It is the most common mosquito-borne illness. I don't know. Does the CDC have a dashboard for West Nile virus? We're going to have to look into that. They do for many different viruses. And, with this day and age, with CDC taking data away, more so COVID data than anything else, I don't know. Do they still have a dashboard? Did they have one? It's not something I actually ever looked at, to be honest with you. I'm going to look into that today. All right, Dennis, the COVID info guy. We have to go to Australia now. New South Wales respiratory surveillance reports week ending the 20th of September 2025. The COVID positivity rate is stable at 3.2%. Number of laboratories reporting COVID, 2 out of 4. COVID cases, 1,056. That's down by 14.9%. Influenza, 4,095. That's down by 22%. RSV, 926 cases, down by 13.4%. New South Wales, COVID-19 sequencing, the NB.1.8.1 is now at 50% of the cases. XFG is at 26. Then there's this PE.1.4, which honestly I don't know anything about. Going to be writing that one down. I've actually never seen this one before. That's at 18% now. So, hey, something we're going to have to keep an eye on. And as noted, half of the regions are down, half the regions are up. So 2 down, 2 up when it comes to COVID in wastewater. All right, moving on now to some not so good news. New South Wales was okay in the fact that things are coming down, aside from the fact that we do see a new subvariant there we've never heard of before. If anyone knows about it, let me know down below if you've heard of it. UK, yeah, not good. UK's significantly worse, 14.3% increase in cases, and you're probably thinking, oh, well, 250 more cases than the previous week. That's not a lot. Let me explain to you something. The UK does not do a lot of testing. So weekly cases, 1,995. Add into the fact a lot of people use these guys right here, at-home testing. There used to be a system called Zoe, I believe it was, where you could report your at-home testing case. That don't exist anymore either. So if the testing that they do sees a significant increase in cases, that's a pretty big red flag. Deaths in the UK, 78. That's down by 1 from the previous report. Healthcare says up by 157 from the last report. I don't know what the total number would actually work out to be. The positivity rate showing 10.2%. But as always, we got to come down here to see what this says. And this says September 18th. It is 10.3% positivity rate. So, yeah, the positivity rate went up ever so slightly, more so the cases went up. So the positivity rate's slowing. I'm encouraged maybe the UK will see some sort of a peak soon, at least for this wave. We'll have to wait and see. Again, seeing cases go up that much in 1 week, which we have not seen in a while, that's indicating that they're probably seeing a bigger rise than what we know about, thanks to these guys right here, at-home testing. All right, the measles update this week for the United States. As of September 23rd, 2025, there have been 1,514 confirmed cases in the United States and 42 jurisdictions, meaning roughly about 42 states are now reporting at least one case of measles here in the United States. Let's talk about bird migration, which can lead to bird flu for a moment. Taking a look at the bird migration over the last 24 hours, if you saw yesterday, you know there's a heavy migration to the south right now. And look at this. Over 800 million birds migrated to the south at the peak last night. That is a lot of birds, meaning likely over 1 billion birds migrated south in the last 24 hours. The risk of bird flu is going to be going up. I did not get a chance to type that into my searches today. Did not get a chance to type in much of anything this afternoon. I'll explain that story to you in just a little bit when we get right before we do CJS data. Yeah, it's not a good story. Taking a look at this, the viral wastewater activity level for Canada's COVID is moderate. Flu A is low. Flu B is low. RSV is low at this time. All right, taking a look at what is going on with the air qualities here in the United States. While we wait for that, let's pause and take a hydration break, shall we? We can see things are slightly better today. Less yellows, still some red in the Pacific Northwest. We'll have to keep our eyes on that. And some yellows and oranges in California as well. And some yellows along the East Coast. And some scattered to isolated pockets of yellows in between. And you are in green. You can breathe easy today. All right, taking a look at what's going on in Pinellas County, Florida. Again, we're seeing a lot of sick person calls. I don't know if it's from back to school. I don't know if there's post-COVID issues with people who had COVID this summer and now they're dealing with long COVID. I don't know what it is, but we've been seeing more sick person calls now. Again, remember, it slowed down there for a week or two. Then we had that big rush in the summertime. But my point is, there's more calls now for sick person than there were, say, before the summer wave. So I don't know what it is. Of course, the South is usually where flu rises first. We'll have to start keeping an eye on that. Again, this is Pinellas County, Florida. This is near like St. Petersburg, near Tampa Bay, all those areas. dealing with this problem with sick person calls, which we've been seeing for now 2 days in a row. Taking a look at Philadelphia on Wednesday, 791 EMS calls were reported. Doing a live look in at Montgomery County, we see a few calls right now, but I'm more so concerned with Chester County. And it may be better than it was a little bit ago, but I've been seeing a lot of respiratory difficulty calls here. That's not good. We see respiratory difficulty showing up, let's see, at least 3 times right now. Earlier, I think it was 4 or 5 times. And then we do see sick person showing up 1, 2, 3 times. I wish we could see Bucks County once again. Now, why are you saying that data report? I have a good reason for that. Let's go over to CJS before we do the Pennsylvania hospitalizations and the New Jersey hospital data, because there is a local story that I think I need to bring to your attention here. Thursday's virus update notes. I encountered 2 cases of people being sick today. The first case, well, this is a real quick story. Did a delivery to an insurance company. I believe it was an insurance company. It was an office. And as I was delivering, it says deliver to so-and-so, and I encountered a receptionist. Receptionist said, leave right here. And at the same time, I heard them answer the phone and say, hello, thank you for calling such and such insurance. And so said, I'm going to be calling out sick today. I won't be coming in today. Oh, I'm sorry to hear that you're sick. I hope you feel better soon. I didn't hear the conversation on the phone, but I heard her say, okay, I'll tell them that you're sick. I'm sorry that you're sick. I hope you feel better. Second story, a little more complicated. You may have seen my virus update from Tuesday, where I mentioned I needed to get tires, and I also mentioned I really don't like going to Walmart, but they were doing the best deal for tires on my car. I needed new tires. Winter's not too far around the corner. As you know, I do deliveries for many different apps, many different things. It just had to be done. It was time. And the Walmart that I went to, as you know, Walmart can be all walks of life. But the Walmart that I went to happens to be in a more heavily Republican township just north of Philadelphia, Bensalem Township. If you're from Philadelphia, you know it tends to be a red area. That's not the point that we're getting to here. The reason why I mention that is because, you know, you have an increased chance of dealing with issues when you're wearing a mask in that area. I've had issues in the past there. Well, this Walmart that's there, the reason I chose it has an auto care center. Well, I went there. My dad actually went with me to take me there. We had a headache that afternoon after that virus update. I said, could you please drive me up there? I just can't drive right now. I had a headache. I was also feeling a little bit dizzy, but I had to get this done. I did not want to reschedule the appointment. To my surprise, I get there, and I see workers from different departments at that Walmart wearing masks. I'm going, whoa. Don't expect to see that. Did not expect to see that in that area. Because let's face it, I've been to that area for other things. That's just not an area you expect to see people wearing a mask. And if you do, it's very rare. This was more than one worker. I saw multiple people wearing a mask. I saw a person in the service department wearing a mask over his beard. I saw various different people. Well, we get the work done on my car. Did not take long. It was less than an hour. I was very impressed. And they said, come back in 50 miles. We have to retorque your tires. I'm like, okay. So I went out today, hit 50 miles just today alone. And I stopped there afterwards. Long line in the service department. I'm going, this is not good. One person working at the desk. I had to stand in line for a half hour. Mind you, I'm hearing people coughing around all over different places. We'll get to the coughing business in just a minute. Not near me, but all different areas. Although, yes, the person at the front desk did not sound too well. So finally, after a half hour, they get to me, and I said, I came back. I was told that I need to come back after 50 miles for a retort, which I've done before. And she says, let me see if we can fit you in right now. We kind of have a problem at the moment. I'm going, uh-oh, what's this all about? Yeah, I ain't getting this done today. Not getting this done today. And she comes back, yeah, we can't fit you in right now. We're on a skeleton crew. We have a lot of people out sick right now. Bingo explains why they're masking. You know, as well as I do, it's probably COVID. So, yeah, Walmart in Bensalem, PA, dealing with COVID staffing issues. Yeah, COVID outbreaks, they're still impacting staffing. All right, I was out earlier in the week doing my deliveries. I was out today. There is clearly a ton of people in my area coughing. I like to do this when COVID is up. I give a coffee meter, more so when I hear a lot of coughing. And at this point, on my scale of 1 to 10, I'm going with here in southeast Pennsylvania a 7 because I have just heard so many people coughing. It's at the grocery store, it's at Walmart. And by the way, going back to Walmart real quickly, we talked about the increase in masking. It's not just there. I'm seeing an increase in masking here pretty much everywhere. Is it a lot of people? But it's more than I have seen in a long time, and we know Pennsylvania has been going upward. All right, continuing on. We spent a long time on that. The story I had to share with you. All right, Tuesday numbers from CJS. Florida, 1,353 new cases and 2 new state-reported deaths. New York, 684 new cases. A quick note about Florida. They're still doing days over 1,000, as we can see there. Puerto Rico, 147 new cases. There were only 3 of the 4 daily updates in that count, so it's a bit deflated. Puerto Rico reported 14 deaths on Monday, which figures to be their weekly count. Yikes, they're still doing a lot of deaths. Maine, 216 new cases. Maryland, 1,174 new cases and 5 new state-reported deaths. Virginia, 2,402 new positive tests. Deaths are unknown because the CDC never updated their deaths dashboard last week. Yeah, that's the update on that. They never updated. Wednesday, hey, this is a better number. 717 new cases, but Florida added another 22 new state-reported deaths, including one from 2020. Yeah, 2020 still comes back to haunt us. How about that? New York, 600 new cases. Puerto Rico, 322 new cases. Oregon, 312 new positive tests and 3 new state-reported deaths. Washington, 959 emergency department visits and 16 new state-reported deaths. Hey, Washington's seeing a death wave. All right, there is a little bit of a bonus coverage here. The CDC reported a national test case positivity rate of 9.5% last week. This will update again either tomorrow or on Monday. Down from 10.8% for the week of August 31st to September 6th. 9,811 hospitalizations, down from the 10,414 that was shown on September 12th. Sorry if you can't see this on the right. I know my camera picture is blocking that. For the week of August, where are we at here? Shown on September 12th, update for the week of August 31st through September 6th. A decrease of about 5.8%. And last Thursday, the CDC provisional national COVID death count rose by 436. Also, New Jersey added all of their probable COVID cases. That's a pretty big addition. It's 32,409 COVID cases. So, big addition for the state of New Jersey. Alrighty, continuing on here, going back to, let's see, do we still want to do the, yeah, let's do the Pennsylvania hospital data. Real quick note, we did that at coughing meter. I just want you to know, that's just for my area. That does not speak for what's going on in New York, California, Florida, Washington State. You come up with your own number. You know what, maybe I will do that over on X. If you happen to go out in the wild, on a scale of 1 to 10, what would you rate a coughing meter in your area? Meaning, what percentage of people do you hear? Do you hear a lot of coughing? If you do, closer to a 10. If you hear a low amount of coughing, hey, you're close to a 1. Maybe we'll do something like that on X and say, hey, some of these results may be shared on here. There's also other things that people do. People check, Yankee Candle Company. If there's a lot of bad reviews about smell, that used to be a way people would know, hey, COVID cases are going up. Take a look at this. We do see a few hospitals, especially in the Lehigh Valley, dealing with problems today. Again, Pennsylvania is still on a wave, and if we go out this direction, while we cannot see the hospital status, in fact, there's actually 2 hospitals now at State College, things are going to be very busy there soon. There is a huge game there this weekend. I'm very interested to see what happens there. I'll be listening to EMS probably starting this evening through the weekend. Taking a look at this, New Jersey, Capital Health Regional Medical Center has an emergency department patient volume issue. Robert Wood Johnson University Hospital also on divert, it looks to be as well, until 4:45 p.m. New York State, I don't know what's going on here. We said yesterday maybe some good news for New York State. The cases are down. Okay, that's fine. Is this another one of those cases where the case data is off again? Or is this a case where the cases are dropping but the hospitalizations are lagging a little bit? Allow me to explain. 1,010 new cases, but take a look at this. Remember what I told you yesterday? If they don't go up big on Tuesday, it's usually a good sign. Surprise! Yesterday and today, look at this. Big increase. Now, yesterday, we did not see the update come out until later in the afternoon. That's telling me they may have been having an issue. I don't know. Maybe CJS data will help us over the weekend or next week, but nonetheless, they're now at 516 hospitalizations, 52 in the ICU. They did pass 516. If they did peak, we should start seeing hospitalizations drop within the week or two. I don't know. Hopefully they have peaked, but this is not good seeing these big increases. They went from 482 on Tuesday to now 516 people in the hospital. Kind of concerning. Taking a look at Ohio, RSV down across the board. 2 hospitalizations for that, flu 13, and COVID 291. So Ohio has dropped, and that drop in Ohio was from 322 COVID hospitalizations the previous week. And on a final note, I want to show you this in Florida. Norovirus in Orange County, Florida, in the northwest region and the southwest region. Yeah, starting to rise once again. That's relatively concerning. Alrighty, folks, that does it for today's virus update. If you enjoyed today's update, give it a thumbs up, subscribe down below, hit that notification bell, share this video with anyone you know, leave your comments down below, and ways to support my channel are listed down below. I will see everyone again next time, which will be tomorrow. Until I see you again next time, stay safe, everyone, and have a fantastic Thursday afternoon. Thanks for watching.